I'm Dr. Sajid. I'm going to try and complete what we started the last time, and that is talk about immunizations or vaccines. I had mentioned that this is one of the most important and effective preventive measures to uh, avoid infections in children as well as in grown-ups. Now, vaccines are formed from germs or part of germs, has been explained to you earlier. Some of them are what we call living vaccines, but they have been so modified that they cannot cause disease, and a lot of them are given in the killed form, which can't cause disease in any case. But they do induce the body to produce antibodies, or like a defense mechanism to protect the child from future infections of that particular kind. So these vaccines have a set pattern, and they're given when a child is most likely to get an infection. So for example, if the child can be exposed to hepatitis B in the first few months of life, that is when these vaccines are given. And similarly, tuberculosis is another one where it's given very early because a baby might be exposed to it earlier on. On the other hand, if the mother has given some immunity to the baby, then this vaccine can be postponed. For example, the measles vaccine, which is given at 9 months. Now, the way it is given can be by mouth. For example, the polio oral drops are given by mouth. Also, the diarrhea vaccine, the rotavirus vaccine, is also given by mouth, and occasionally available typhoid vaccine can be given by mouth in the form of capsules, although it's not generally available most of the time. And also the injection may be given within the skin. It is what we call intradermal, and there are some vaccines, the most famous being the BCG vaccine, which is given in the skin. And then under the skin, which is subcutaneous, which for example measles, German measles and chickenpox are given in this form. And then intramuscular, which means into the muscles, deep into the muscles, and the examples are for example the pneumonia vaccine. So the number of doses are also fixed. It depends on the kind of response that you get with one dose. So some vaccines have to be given repeatedly. For example, the diphtheria, tetanus, whooping cough vaccine has to be given 3 times within the first year of life, and usually about 1 month to 2 months apart. And then there may be others that are given only once and may not need to be given again. And also depends on how common that particular condition is in a community. So in some communities, for example, in Africa, yellow fever vaccine is given, but not necessarily in Pakistan because it's not seen here much. It also requires boosting in some instances, which means an extra dose have to be given. So for example, the DPT vaccine, you give a booster at 18 months of age, and then again at 4 years of age. And others, for example, measles, mumps and German measles may need only one more shot at least after the first one, and then perhaps in entry to high school. So it is a prescribed course and that you need to follow, and you have to do that in consultation with your doctor. A lot of the vaccines are being given by the government, and those are pretty good vaccines, and you should avail that opportunity also. A few things about vaccines that I'm often asked. One, can you give more than one vaccine at a time? Yes, you can, and these have been worked out very well, and there are schedules to follow. So your doctor will know that 2 vaccines can be given at the same time. They may be given at different sites, but can be given. And the second thing that a lot of parents want to know is what happens if they get their routine interrupted, the schedule interrupted, what do? Most of the time, you don't need to restart the vaccines. You just start from where you left off, and your doctor will be able to guide you about this. So this, I hope, completes more information about vaccines. I will at some stage talk about vaccines for each age group and its usefulness. So once again, vaccines are a single most effective preventive measure fighting against common infections, especially in children, but also in grown-ups and in older age groups.